Thank you for sharing. You know, fun fact about Harry Potter series, my son, when he was in kindergarten, that was his favorite series. And he read the first book when it came out. And then the next book, he'd read the first and then the second, and then the first, second, third, then the first. So he has read the Harry Potter series multiple times. Okay, we'll go ahead and get started. Please keep sharing your books. My fun fact for the morning is that I decided that I would read 60 books this year. And I just finished book number 48, and it was one of my favorite. It was called Atmosphere, about astronauts. And I highly recommend the book. Oh my gosh. The other I recommend is called The Measure, which really makes you think. So I love books like that. And anyway, I'm on track to read my 60 books. I turned 60 in January and decided, and suddenly oh my gosh, I've read so many books. So here we go. So I'm Pam Powers Moesser. I work in the Office of Clinical Trials Operations. My role is quality and operations. We're a small team and we're fairly new. So you're going to hear about what we're doing and what we do with Smartsheets and how it's working for us. So my life is all about this little girl here. This is Tinkerbell. She's my Great Dane. She's 2.5. And when we got her as a puppy, she was a terror. She's really cute, but she was awful. And the dog trainer said, well, you know, Pam, if you get another one, it will help. So now we have 2 giant baby dinosaurs, we call them. This is Tinkerbell and Captain Hook. And they are the reason I work a full-time job. But they are adorable. And Captain Hook is actually working to be a therapy dog over at the hospital. So someday, hopefully, he'll be a good boy or the bestest boy to be able to do that. I mentioned my son before. This year, I became a Nana. So I have a little grandbaby. His name is, oh my gosh, his photo's covered up. His name is Cal Taylor, and he is absolutely adorable. So I'm going to move this so you all can see his little face. So he's almost 3 months old. My son actually went to medical school here at UNM, and he graduated. He's now a 4th year chief resident in surgery at Phoenix, and his wife is at Children's Hospital as a pediatrician. So I'm a very proud mom, Nana, mother, stepmom to a couple other kids. So anyway, and one of my pride and joys is my Core App badge. If you have not done this through Smartsheet, I highly recommend it. I started using Smartsheets a little over a year ago in my work, and doing that really pushed me. It pushed me to learn a lot of new things about Smartsheet and really expand. And it was challenging. It was really challenging, but I felt so accomplished when I finished. So get your Core App. So today we're going to talk about several things. First, I'm going to go from doing this with the end in mind. I'm going to show you where we are as clinical trial operations because of Smartsheet. Then I'm going to talk to you about what we're doing with data, as well as get to forms, which is what has really helped us a lot. And I'm going to talk to you about that. And then the next steps for us as a department and what we really want to do. So a little bit about this, right? In this session, I'm going to talk to you about the why, the what, the who, and then how it really has helped our department. I am not sponsored by Smartsheet, but I tell you all, if you don't have it, you should get it, because it really has transformed our work and what we're doing for the hospital, and some really important work, really. So here's our big picture. We have been able to gather data in a number of areas, or data. Just depends where you are, which you call it. We have both, data or data. But one of the first things we did is we started collecting where are there clinical trials happening across UNMH. And what we have ended up with as of July was about 105 clinical trials. Now, if you start to think, oh my gosh, I bet there's a lot more, there is, because there's also observational studies. And then in addition to that, there's also pilot studies. Some of those cross over to ours, but the Cancer Center does a ton of studies as well. So this is specifically interventional trials that use a hospital service. And that's what we were really trying to help find. We have worked and trained about 23 different departments across the hospital, and they're all listed down along the bottom. And then we were really interested in where are trials by their status. And so through Smartsheet, we were able to gather that information. And it's been super helpful to us. We also, using forms, are tracking a monthly update automated, and then quarterly, we also request that information. So there's a number of things we're doing. I just wanted to show you, like, this is what it could become. If you were in the last session about dashboards, oh my gosh, that was amazing. And I'm going to like watch it again and go back through it because we are working to make an incredible dashboard using Smartsheet. It's just we're not quite there yet. So we're working on that. So I like to call this how Smartsheets has made us even smarter. As I mentioned, we're tracking clinical trials across all these different departments. Slowly but surely, we started out with lists of like about 400 and narrowed it down. And then as we've continued to get more accurate updates using forms, we have started to compile more and more clinical trials, and they've been really much more accurate. The automated form has also really helped us to do that because every time they go into a form, we ask for updated information, changes, and ultimately, we're trying to improve a process. And so that's what Smartsheet is helping us to see. And I'm going to show you that in a little bit. But really, in a clinical trial, we're looking to like decrease the length of time from when a study team is in what's called startup, when they first go, hey, this is a really cool trial, we want to try it out, to opening to enrollment. And that's when you start bringing the study patients in and you start getting more and more. So let's talk a little bit about the data we're collecting and how we're doing that. So the first thing we did is Jillian helped us build a Smartsheet. And we started out with, I don't know how many columns in it, but we had columns. We loved seeing the study type, the sponsor. Then we added, is it federally funded or not, which came to light in recent months. We were trying to help see where we could support better, what was going on with that. And then we started to add more and more information. We use a lot of stuff from CTSC. We had some really cool drop-down menus we got. We started to realize study teams wanted an additional name. We added more rows. We added more stuff we saw we needed, more information about study teams. And then we added even more. So we started to look at how many days was it taking a process to happen and tracking that right on the Smartsheet. All these columns, it was so easy to keep adding columns. That is a good thing and a bad thing sometimes for me with data collection. But I like to call it sheets gone wild at this point. We're just like, we add so much stuff. It's like the next thing you know, my boss says, hey, I think it would be really interesting if we found out. And so then we just add another column. So it's great. It's very fluid and it's very flexible is really what we've found. So how we're collecting all of our data is through forms. And we have a number of different forms that we're using. The very first one that we created with Jillian was an intake form, right? To start collecting all of the logistics is what we call it. So it's everything around the study and what's going on. One of our most important boxes at the top was the initial submission date, because that started our time clock as well. And it was really a great marker because every time I go back to it, I can sort the rows by that initial submission date. And it helps to show us what's new, what's happening, what is on our radar right now. So those sorts of things really were helpful for us. Also, making certain boxes required or not has really helped as well. We look for different things like study type that they're doing. And so it's a drop down menu. As I mentioned to you, we're only tracking interventional. So if a study's observational, sometimes we're interested in it because even though it's been labeled one thing, we look at it and we find out it's something different. What's been great too is we created a drop down with all the contact emails that just populate for the different physicians who are doing any work through the hospital. And those are called PIs. So that's the physician who is running the study. We also started looking at, and I mentioned to you, people, when they looked at the form at first, study teams were like, can I have an additional contact? And it's something to think about when you start collecting in a form where there's someone you have to contact a lot, because there's a lot of change. People change positions, right? We were talking about that before we started. And then there's also the possibility of someone's out and I get no response from the Smartsheet form. And so then I can reach out to somebody else. So it's always good to have that. And then sometimes we're interested in who else is involved in the study itself. So are there other team members that we should know about? And we allow them to do things like write it in. So just when you think about your own data collection and what you would use this for, the things that we found really helpful. If you have something that's a concrete like a department, we also have that. But we also have realized there's a lot of variation in departments. So we start to work at kind of narrowing that down and look at that too to figure it out. So we're looking for the physician, as I mentioned. We have a drop-down menu for that. We look for all this other information that they can find right on one of the study documents. It's called the protocol. So a lot of this is in there. We look for an official title. We like to be able to refer it using an NCT number, and that's how it's the National Clinical Trials Database. So all these things are important elements for us that we can help to put together in our data. And then just more data that comes to us using either their protocol sheet, other pieces that really is helpful for us. And then we're really looking for any services that are going to be involved. So we start to populate that within the form, and we've started to see what are different departments that we need to be connected with. So it's another way that forms has been really helpful for us. And then we get into a lot of dates. So these dates are all really important, as I mentioned earlier. We want to know when their study startup started. We want to know when it ended. We have different status within studies. So we really want this form when they first are in startup, not after. And then we track it through the life of the trial, which comes in our automated update forms. We'll talk about it in a minute. We've worked close with different departments. So CTSC helped us create a really great comprehensive drop-down menu of all the things they offer. So the forum has also really helped us to collaborate with other departments that really support clinical trials across the hospital. And then our final piece, I know it seems like a really long form, but I promise it takes study teams 3 to 5 minutes to fill out the whole thing. As long as they have the protocol and all the information they need, they're good to go. But we also ask them to upload documents, and that has really been helpful for us as well to have the document uploadability within a form. It compiles all the attachments to the side. They're easy to see and find if you're looking at a glance, and they're easy to download as well. If one study has multiple documents, it will actually zip them together and download them that way. Sometimes it's good, sometimes it's not. If you're really wanting individual documents, just download each individually. So before I go into automated updates, I want to make sure I check the chat. If anybody has anything, okay, I've got some really great books. Thank you. Oh, thanks, Dina. Yep. Look into the core app, Learning Path. So Dina put the link right in there for you to let you know. Okay. If you have any other thoughts or comments, please just put them in the chat and I'll keep checking. I can't see it right away as I've got the screen open for the session. So here's a list of all our automated updates that we're currently asking for and doing. One of the best is that I receive an alert when there's a change to any of the rows within our Smartsheet. That really helps us because it lets me know when a study team has gone in and they've changed something with an update, or I also get alerted when there's a new study added. The next one we created was the monthly tracker reminder. And that goes out to a specific row, that goes out to that primary contact row. It goes out monthly. You can set the date, you can set the time. We chose the 10th of each month and it comes in the morning. It's nice because it's not like the first Monday of the month where people are inundated. I wanted them to have a little breathing room and be able to get their month started or get even their week started. So our update went out this past Sunday. And so this week I've been receiving update complete notifications that I'm going to show you. The other is that we realized, so in clinical trials, studies don't change status that quickly. So study status changes, well, some change faster than others. But once they open to enrollment and start having patients in the study, that process goes a little slower than study startup. And so at that point, we're asking for every 3 months, we send them an automated request. That one goes out the first Monday of the month. And they're able to go in there, change any rows, let us know what's happening, and update us on the status. So we're really looking for those status changes that are so important to us in clinical trials. This is the update request email. This is what it looks like. And so it simply says, please update my online sheet. And then they click the blue button and it opens up the request. And what populates and looks like is all the lines on the form that they have previously filled out or are filled out within our trial tracker and what that is. So it generates all that. They can update any of the boxes. Sometimes there's different boxes that maybe have come in. So like once a study has started past study startup, the automated request starts asking them for what's called a guarantor number that's assigned to the clinical trial. Sometimes a protocol changes. They're able to upload a new protocol, change the version. And so it has really simplified it for us rather than having to contact 105 different studies and say, hey, could you tell us what's going on? You know, reach out. This has been a big game changer for us. If one study team has more than one clinical trial, then the Smartsheet sends them just one email, which is also brilliant. They just click on next and it takes them to their next clinical trial. So I grabbed a snapshot of some of my favorite things that happens within the form. One of the things I love is up here on the left near the 4, you see a little bell and it says notifications. When I click and open that over to the right, you see I had a new clinical trial submission. and it lists those out. You can also dismiss, you can delete once you've seen things. It also lets me know about any messages or other changes. And so if I'm not quickly sorting the Smartsheet to what I'm looking for, I can find that information pretty easily from those notifications and that other piece over there. The other thing I like to look at is the activity log, because if I open that on the right side of my Smartsheet that I'll show you in a second, it's also helpful. As you can see, I go in the Smartsheet a lot, and it registers whenever I have done something, but it also tells me, if you look down through the center, you see where it says form user right here. That tells me that somebody has changed cells in this portion right here. And so I can look to see what changed or got updated. So those sorts of things are important. I can usually spot it without this, but if I'm wondering and we're curious, I can also look back and refer to this. So this has been another really helpful thing for us. So that's what I have for my slide deck. So thank you. And I'm going to go into the Smartsheet in a second and show you some other things. If you don't know, this is vertebrae C6. And so it's one of my favorite little smile faces. I'm going to open back up my Smartsheet and show you a couple things live on there. Do I need to go back to, uh-oh, what is it doing? Let's see. Hang on. I had it open and ready to go. Hold on just a sec. Let's see if it goes there. Okay, there we go. It's thinking. How many of you currently use Smartsheet? I'm looking on the group as well. It's interesting. I always hope that whenever I have attended any Smartsheet, either courses or workshops or online learning, I always learn something new and different. One of the interesting things, I mentioned the dashboard session last session this morning, and we were discussing color on items that you do. A fun fact, my son is colorblind. And he didn't find out or realize it till middle school. But when he got into med school here, 75% of the boys in med school are colorblind. There's a fun little piece of information. It's crazy, right? But boys are more commonly colorblind than girls. But I do love that in her session, she shared the colors and there's a color chart. So go back to that session if you didn't attend it to get the color chart, because it's really important that your colors are ADA compliant. I helped build a website in a past life where suddenly I realized that we weren't and we were changing colors a lot. So all right, a couple of things on here that I really do like. The last modified date column is one of our first up here. And that column helps me quickly scan to see not only if I have done something in there, but if someone else has. And then over here, I can also quickly go over and see where there's attachments. As I mentioned, over here to the side, it lists all the attachments. And in fact, if I change the column, it'll list all the attachments that had been attached to any rows. I mentioned as I download attachments, if I click on multiple buttons and then download, sometimes it zips them together. My team likes them separated, mostly because we do different things with different items. So another piece of the work we do is around Medicare coverage analysis. And so Crystal in our office is our finance analyst, and she helps trial teams look at the proposed budget, and she does a Medicare coverage analysis just to make sure that things are going to be covered the way they should be for the study team and for the participant in the study. And so it's really important that we separate it out. I'm interested in the protocol. She's interested in the budget. So anyways, if I just save them separate, that's really helped us out. The other place that I live and do a lot of work in is update requests. And I love this because I can quickly scan and see all the updates that have been done. And it's
so the screen is still showing the PowerPoint slide.
What? Oh my gosh. I think Susan said that. Okay, I have to switch my screen. Thank you, Dina, for catching that. Oh my gosh. Yeah. Oh, it's awesome at my vertebrae. Okay, well, let's go back and share the right screen for you. All right, let's make sure y'all can see the right thing. There we go. Okay. Thank you. So this is one of the pieces that's been the most helpful to us. This starts from the very beginning of time and goes through all the update requests that we have. It also tells me when it's still pending. I use this a lot. I discovered that I can click and I can reverse from ascending to descending. And I love that because then it shows me, again, all the trials that I need to look for going backwards. And so this is some of the data that we have been able to compile is getting update requests or how those updates look or how quickly we get updates and so forth, because there's also a marker. One of the other things that I really love about even the cells, if I go across, and I mentioned to you all, don't get seasick here. Hold on a second. But we can go to current study status, right? And that was one of the things that I mentioned to you all that we're looking to try and help how quickly studies can go through a certain status, right? I can click within a cell and I can view the cell history. And it also tells me who has changed the cell. So for example, I did something in this cell where I helped to put it as study startup. The form user changed it to open to enrollment. And so that actually was backwards. That's an example of the study was actually still open to study startup. I don't know that I picked the best cell for you just now, but it gives you the idea of the history of a cell. Sometimes we're also looking to see, I told you about UNMH resources, right? The other that I mentioned that I wanted to show you too, I'm going to go backwards here. Working with CTSC, I mentioned to you that there was multiple services. So it's great because Susan helped us to create this great drop-down menu. Study teams go in and click everything they need, or they can click all of the above or not applicable if that's what happens with that. So that's been really helpful. Along the side, if I want to quickly look at any comments that people have made to any of the trials, they'll all appear here. And so I can look at this by the row, I can look at all, such as this, and I have different comments that have come up. And that sometimes study teams need to give me a little more information. And so we've found that having a comment box also allows that and has been super helpful for us as well. This is the activity log that I showed you all a snippet of before. And I really like this because it also tells me when people have interacted with the form, and also it tells me what they did. And so sometimes as a team, we've been talking about a different study and somebody has said, well, when did that happen? And so I can go in here and quickly see, or who changed that? So that's another way we can track down who might have manipulated what and why. So I won't say I never did anything that maybe was a mistake, but that could happen as well. What else was I going to show you? This is that activity log. These are my buttons that I just absolutely love to have and to use a lot of. And all the way over across. So I'm able to also share, this was something new we did. Good Clinical Practice came out with updates in January, and we wanted to make sure that study teams had that. So as we do a logistics meeting, I make sure that I've shared the updated guideline, and then I can click the box and let them know that we've done that. I mentioned to you all that we're looking at timelines, right? So let's say a study team submitted their study right here on the 17th. We did a review of the study the next day. That was within our 1 day, and I wrote the number of days. Then we do a logistics meeting with the study team. We're also looking to do that within 10 days. And so I'm able to track that, give them what they need. This one was requiring an MCA, the Medicare coverage analysis. And so we mark when we get the documents because the trial tracker records that. We're able to do the required date and then list the MCA date and when it's done. So there's a number of things. This has been super helpful for us with our Smartsheet. Yeah.
So, you know how you mentioned that you have some guidelines that came up that you needed to go over. So you were able just to add in a whole new column. Of
yes. The ICH column.
So even as stacked as it is, you just add another column and put in what you need, and it could be yes or no or whatever. Okay.
Yes. So that's why I called this Sheets Gone Wild, because we have added, like, the original one did not have this many columns. I think we think about something new constantly, and we are sort of at, I would say we really are at our limit. I don't think we want to add anything else. Every once in a while in a team, my boss will say, you know, what if we were to add a column that, and then she goes, wait, it's really long and lengthy already. So we've got a lot in there already. So we're really trying to minimize that. The other is that the thing to be mindful with automations, I think one of the things that our lesson we've learned with it is that for study teams doing an update, we really are trying to give them a minimal amount of information. So like, you know, we don't want it to populate every single thing, but there's a lot of things we do need them to see. The main thing we're looking is, did the study change status? Is there a different protocol? The version of the protocol, when did the date change? And then we need like the status change date as well. So, you know, we're trying to keep it to a minimal. Most study teams, if they have everything right there with them, can tell us what we need in about 3 minutes per study as they review it. I'm going to open the chat back up. See what else. Okay. I'm seeing the other messages, so I'm hoping you see the right thing now. Then I'm so sorry. Any other thoughts? Anybody, although you may not be involved in clinical trials or something else, any thoughts about how data collection using forms could work for you all, or that you see some of the comparisons with what we just went through? Anybody see something that, or something you do that's really cool that I should be doing? Please share that too.
One of the smart sheets that I work with is, we have requests from other departments to do allocations, reallocations. So the smart sheet that I use, someone uses the form to fill it out, what changes they want, what department they're from, date, the allocation, everything. And then it triggers going to the accountants. And then once we read it and we accept the change, then it goes into the smart sheet as, getting processed. And then there's some different alarms that go off to the DA, the department administrator, so she can make sure that the FIPSI matches. And so if we don't get a response from her, we can hit another button that triggers her to take a look at it. And then it gets finally approved. And so once it gets approved, then we can process. So
Yeah.
it's kind of nice to have those. You're not just doing it, you're having the
Right.
approval first
Yeah.
to make sure everybody's in agreement with what the changes are going to be made. And then once the request has actually been processed inside Banner, then I go back into the smart sheets and hit completed. Then it gets put to an archive. And then it gets a message sent out to the person who requested it originally saying that it has been processed.
Wow. It's I love that the process helps you all to do something before things could go sideways. I mean, it's great. That is really great. Anybody else, anyone in the chat have something, or maybe there's a cool feature that one of you uses. Amy, thank you for sharing the color accessible chart. That's great. That's the one that was shared during the session. So thank you for sharing that in the chat. I think that I'm constantly figuring out new things. I think that won't ever end. As a former educator and still educating people, learning new things is really great. As I told you all, learning the Smartsheet the core app was very hard, at least for me. Some of you may have already got yours and said, wow, that was really easy. But it was a good challenge in a good way. It made me really think. So, all right, I am going to end there. If there's nothing else, if anyone else has anything they want to chat about, just let me know and we'll be around. And I really appreciate you all taking the time. I am a beginner and I hope to get more intermediate at some point in the future. But anyways, thank you all for joining. I really appreciate your time.